Hi, my name's Olivia. I'm going to be doing a peer response view over Julie Blackwell's thorax and lungs and cardiovascular assessment. First of all, I'd like to say great job explaining what you are going to do to the patient. That definitely makes them feel more at ease than just coming right up at them and starting to touch them. I do want to mention that if it was a real patient, if they said that they didn't know something, you would explain it, but I know you know that. Since it's just your kid, it's kind of a weird situation. I will say good subjective data for the heart and for the lungs. You had a really nice layout with the eye, the inspection, the percussion, the palpation, the auscultation. I will say maybe mention your landmarks a little bit better, like the clavicle notch, it's the sternal notch, and then finding that angle of Louis that's on the sternum. And then I also noted you did check all the pulses, which was good, but like for like the radial pulse and the pedal pulse, check them simultaneously. It's just something I was always taught. Check them simultaneously to make sure that they're even, because sometimes that way you can actually find out if somebody has like an extra heartbeat or they aren't equal on both sides. I do want to mention that you had really good lung field descriptions. You mentioned what you would normally look for in an adult and what you would look for in her since she's a child. So I thought that was a really good idea. I will note for the AP diameter, you mentioned it was 2 to 1. Just kind of reverse that. It's 1 to 2. It's the chest to the back, so 1 chest, 2 to the back. And then I guess my question, I have 2 questions for you. The first one was, where would you listen to the mitral valve or the apical pulse? It was kind of unclear. You said part of it, like that 5th intercostal, but there's another part to it because that's right at that sternal border. And then where would you not hear resonant sounds? Like when you're percussing, over what areas could you possibly not hear those sounds? But like I said, overall, good job.